Hi, my name is Claire, and I'm here to talk about my recent project for Vision Tech. What I basically did is, I'm a junior this year, and I wanted to look more into the role of physical therapy and look at what that job entitles for me, because I'm interested in that. I also looked into some nutrition facts and stuff, because I am a swimmer and I wanted to know how to increase my performance, and nutrition is stressed in that sport. So here we go. Physical therapy. I just put down some average pays and average work hours for physical therapists. As a physical therapist, you are required to have a graduate degree from a certified PT program, meaning from a certain program that has all the requirements and needs fit for a physical therapist to kind of start you up. And from there, you get your bachelor's degree, and that is the first step. And from there, you will either get your master's degree or a doctorate degree. And your master's degree is sort of the primitive version of physical therapy, I guess you could say, because what happens if you have your master's degree and you're a physical therapist, you will get recommended a patient by a diagnostic doctor, and from there you will have to treat the patient according to what the doctor says, and all that stuff. So your patient is gonna have to refer to their diagnostic doctor, and then back to you, and then back to their diagnostic doctor, and it's just a whole jumbled mess. But however, if you acquire your doctorate degree, you will be able to, your patient will be able to come directly to you, and you will have the power to diagnose, treat, prescribe medicine, stuff like that. So you are a doctor in the literal sense, because you do all that stuff. And one thing that law that has been passed is that by 2014, all physical therapists are required to have their doctorate degrees, and the option for master's degree will no longer be attainable. Physical therapy specialties. Physical therapy, something that's really neat about physical therapy is that most people think of it as treating your body and doing all these stretches and stuff like that, but that's not all physical therapy is used for. Physical therapy can be used to heal the mind, body, and even the spirit, because you can be treated, if you have an injury, you can be treated that way. If you live with a mental disability, or you were in a wreck that caused you to have a mental disorder or something like that, your physical therapist can help you deal and learn how to cope with that and continue your life as an individual. But some physical aspects of it that you can go into would be an orthopedic physical therapist, the musculoskeletal system, recovering from orthopedic surgery like sports injuries, arthritis, amputations, etc. Neurological, again, this has to do with the brain, dealing with any brain disorders or mental illnesses that you may have. Cardiovascular, your heart, strengthening your heart. Pediatric, dealing with physical therapy for the child in any aspect. And there are physical therapy specialties such as that help you with aging, weight loss, your ankles, neck, knee, disc malfunction, Parkinson's disease. It's just really whatever. When you're a physical therapist, again, you can help heal the mind, body, spirit. It can be used for a vast variety of illnesses and injuries. Here are some resources and works cited. Something I probably could have done better about this project is I kind of used only websites that I found were credible. If I had to do this project over again, I would have gone into some databases or maybe even contacted a physical therapist and talked to them. But just a little bit more research and finding stuff about reliable sources, even that aren't internet sources. So that's something I would have done differently in this aspect. Now on to the nutrition. I focus mainly on nutrition for athletes, and here is the average pay for a nutritionist. Eating for you. For an individual, everybody needs balance. Balance also consists of conscious food choices, like choosing apple slices over fries or stuff like that, and there are endurance eating, quick energy eating, and balanced eating that pertain to you and what you need. So first, we're going to talk about endurance eating for practice and long activity. And for what this does, Endurance eating. Athletes who perform endurance sports need lightweight, carb-filled energy substances in order to perform at their peak. This pertains also to any kind of practice. So basically what happens is your body is able to produce enough energy for yourself for 30 minutes. After that, it starts taking energy from your muscles. What that first 30 minutes is your liver working in order to burn fat, and that's what your energy from your fat stores for the first 30 minutes. And after that, it starts taking your energy from your muscles, and then your muscles and tissues start to break down and wear away, and it's just not good. So if you are an endurance athlete such as a marathon runner who has their heartbeat going at a constant pace for 2-3+ hours, and you just need that energy to keep it from your muscles deteriorating, you will need to take in some kind of an energy substance. And when you take in an energy substance such as like a goo, a gel, energy blocks, Clifford Gatorade, I'll show you what those look like later. Once you take in these in after that first 30 minutes, it will keep your body from taking your energy stores from your muscles and therefore protecting your muscles. Here, I'll show you what a picture of the energy substances would look like. Here are some of the goos, and they are what they say. They are goos, and they're kind of like these gel things. I don't recommend any of the fruit-flavored ones. Just stick with the chocolate, vanilla, peanut butter, stuff like that. Stinger waffles, a little bit heavier than any kind of goo, but they're still pretty light, relatively light. These are good for biking, like what you can see on here and stuff like that. Here are some of the Clif Blocks, and they're kind of just like gummies, I guess you could say. And here are another version of the goos, which is just a gel. It's another brand. But these are all good energy substances and energy supplements. Sorry. Going back to the PowerPoint, endurance eating. So yes, those are examples of endurance supplements. Now, quick energy eating and balanced eating. An athlete, depending on what you do, you will need different types of energy. For example, like we talked about, the marathon runners need a constant source of energy because their bodies are constantly taking energy from their muscles. But however, if you are let's say a weightlifter or a sprinter, you will not need as many carbs and as protein because you will not be constantly taking that energy from your muscles like a marathon runner would be. Or a swimmer would be. So let's use the example of a weightlifter. A weightlifter will not need as many carbs. They will need, however, more protein. When they are weightlifting those heavy weights, they are going to be breaking down their tissues and kind of almost snapping them. So that protein, that extra added protein, will help fill in those muscle tissues and help repair them. So more protein for like a weightlifter, more carbs and stuff like that for a marathon runner. Maybe a half a packet of goo before your weightlift, or half a packet if you're a sprinter, like you're running 3 races, maybe half a packet for a series of races. And that's all you need. A recovery after athletes perform or practice or anything like that, no matter what you do, you will always need protein because in any kind of exercise, you will be breaking down your muscle tissues and stretching them or whatever you're doing, and that protein helps to repair and replenish your muscle stores and supplies, and it will eventually help you to build muscle, which will entail a lean body. There has been a lot of debate about whether you should weigh yourself, and when you weigh yourself, it can be either a positive or negative thing. Some of the negative things is that when people get a little bit overboard and they weigh themselves every day, it can become a depressant because it affects your emotional health. And the thing is, most weight like scales might not be able to weigh you correctly because due to the power-weight ratio. Working muscle is much, much heavier than extra baggage or that extra fat. So if you are an athlete who has tons of muscle but wears a size 4, you may weigh more than someone who wears like a size whatever is big. And even though you may have a smaller like looking body, you will most likely weigh more due to that muscle. However, some people think that they need the least amount of body fat as possible, but your body needs fat because, as I said, that first 30 minutes of any kind of exercise, that's where your body gets its energy. So men, their least amount of body fat that they can have is 5%. Women need 12%. So yes, women do tend to have more of the higher body fat content, but that is what they need and that is what is healthy. And the fact that you need to remember that everybody's an individual and everyone needs their own personal category for calories and weight and exercise ability. Everybody will be individual for that. What if an athlete is injured? An injured athlete is actually, this is a time when you need to get in a balanced nutrition, minerals and vitamins and stuff like that. So basically what happens is once you're injured, your body's metabolism speeds up due to metabolic responses, catabolic responses, emotional and physical responses such as racing hormones and other factors involved. So once you're injured, all those stuff comes into play and your body's sort of going into this fight or flight mode where it's kind of panicking, and due to the increased metabolism and increase of hormones, your tissue will start to break down, and in turn your muscle will start to deteriorate as well. So during those first couple days after you've injured yourself, and this is talking about if you seriously injure yourself or even just roll your ankle or something like that, you will need a slight increase in your calories depending on what you need, or you may need a heavy increase in calories during those first couple hours or days in order to protect your body from breaking down all your muscle around that area. You also need an increase of vitamins and minerals, and I'm not talking about taking all these heavy supplements. You don't necessarily need that. You need those extra vitamins and minerals that come from dark fruits and veggies, maybe a multivitamin or something like that. But something else that's also needed is protein. We talked about how protein helps build muscle and repair it. Same thing goes with when you're injured, because when have broken down that tissue around wherever you've injured it, let's say a rolled ankle, you will need protein to help repair those muscles and tissues in order to strengthen it back up again in the fastest way possible. But eventually, if you are out for a season, like let's say you have broken your ankle this time, and you have increased your calories, you will eventually need to start decreasing that over the next couple days, and so that you protect yourself from gaining harmful weight such as fat or anything like that. A gradual decrease would be good. Balance. There, I just go here and talk about how Michael Phelps himself, everybody's gone on this, especially since the 2008 Olympics in Beijing, when Michael talked about how he ate 12,000 plus calories a day. In this video that I was going to show basically talks about how he says balance is needed for even him, even a highly tuned athlete like himself. That balance is needed even on days that he's just relaxing or laying around. He doesn't eat that much. He eats what his body needs in order to maintain a healthy weight. So it just depends on what you're doing. You just need to adjust your calories by what you're doing and what your body needs. Listen to your body and make sure you have balance for your individual needs. Got the flames going here. Resources and works cited. Again, something I would have done differently is gone to more reliable sources like databases or something like that to look for information. I'm not sure if there would be any for nutrition, but that's something I should have probably looked into. So I would do that differently. But some things that really worked for me with this project is that it helped me gain a wider knowledge of the things I wanted to learn about. I learned about what I needed to, and it has helped me increase my performance in the pool because I'm a swimmer. So all of this knowledge I have taken into account, and it has helped me. That's my project, so thanks.